Most people think their gums are receding because they're brushing too hard or that they're not flossing enough. And sometimes that's true, but I want to tell you something I tell my patients that surprises almost every single one of them. Sometimes it has nothing to do with that. Sometimes it's caused by something you do every single day, all day long, and you might be doing it right now. And nobody has ever told you that it could be affecting your gums. Stay with me till the end and I'll show you what it is and what you can do about it. Here's the part that confuses a lot of people. They come in and say, I didn't change anything. I brush the same way. I always haven't changed my diet. I'm not on any new medication or anything like that. So why is this happening now? And that's actually the right question to ask, because the answer isn't always something you did or something you didn't do. It's sometimes just something in your body has changed. I had a patient that came in not too long ago and they were complaining of sensitivity to cold, especially when they like ice cream, stuff like that. And when we pulled up their scan and we're comparing them from 6 months earlier, we noticed that there was a change in the gum level and it was very visible on the scan and in the mouth. Even though nothing about her routine had changed, everything was basically the same. She wasn't on any medication. And that's the part that gets me every single time, because from the outside, nothing has changed, but on the inside, things have shifted. And that's what happens with estrogen. When estrogen drops, your gums are affected because gum tissue actually has estrogen receptors in it. And when those levels go down, the tissue gets thinner and it responds strongly to irritation more than it used to before. It would handle it fine before, but now it cannot. What you may know is that estrogen also it doesn't just affect your hips and your spine, it affects your jaw. And studies do show that postmenopausal women have measurably lower jaw bone density than premenopausal women. Once you lose bone, your gums will follow the bone. Now let's talk about one that you've probably heard before. If you have recession, chances are someone has pointed out and said, hey, you're brushing too hard. And they may have been right. Sometimes you may be brushing too hard, but most of the time, what actually happens is a lot of people would actually switch to a medium bristle toothbrush or a hard bristle toothbrush. And this happens when they're like, hey, you know what? I'm getting older. I want to make sure I keep my teeth clean. Some patients are like, to keep my teeth clean. And I just feel like this soft bristle toothbrush is just not doing enough. But I want to tell you that just because you feel like it's not doing enough, that's not true. The feeling is not accurate. The soft bristle toothbrush is doing the job, and that's all you need. The medium and the hard bristle toothbrush is just doing damage. And if you really want to know how hard you're pressing, if you're like, hey, I just don't know if I'm pressing hard, go ahead and get a toothbrush with a pressure sensor. Usually like the one that I have, if you're brushing the right pressure, it's going to be green. So you're putting enough pressure. If you're putting too much pressure, it turns red and you just release immediately, because you want to make sure that it's light pressure, bristles are soft. Then you're keeping your teeth clean, but you're also protecting your gums. So something to remember is that use a soft bristle, light pressure, small circles along the gum line. That's enough. Now the brushing one where it's like you're brushing too hard, this is one that everybody has heard before. But the next two, you might not even realize they're connected to your gums at all. If you're finding this information helpful, subscribe. I put out a video like this every week. So now to the next cause, clenching and grinding. With clenching and grinding, you may not even know that you're doing it. And most people, it's worse at night. And so when you wake up, you have no idea that your jaw has been working for hours. But just so you're clenching and grinding can also happen during the day. Most of the time, people clench when they're concentrating, when you're working out, when you're stressed. But it's just that in the day you catch yourself, right? But at night you don't. Sometimes I bring it up in an exam. They would do the diagnostic exam, and then I'm like, hey, what? Looks like you're grinding your teeth are wearing down. People take it very lightly and they're like, I grind, it's not a big deal. So what? It's not affecting my life. I'll just go get a generic guard online and they move on. But what you don't realize is that your jaw is a lot of pressure on your teeth when you grind, when it's not the same pressure as the bite force. Sometimes it can be up to even 3 times higher, and that force travels to the bone and that bone starts to break down. And remember, we said that when the bone breaks down, the gums are going to follow the bone. And so when the gum breaks down, so that the gum just goes right on. And then that's recession. And just so your generic guard doesn't fix anything, it doesn't help. It can even change the way that your teeth come together, which then increases the clenching So you want to make sure that when you're going to get a guard, you're getting one that's custom made to you. And that way there's no imbalances. And so now I'm going to go to the next one. And this one is the one that you're waiting for, the one that I said it surprises a lot of people. And just fixing this protects your teeth, not just from the gum recession, but it can protect you from a whole lot of dental problems and actually save you a lot of money. So when your teeth don't come together, they should, like your bite, every chew, every time your jaw closes when you talk, the pressure is not distributed evenly. So some teeth take more of the load than others instead of it being on both sides, right? So one absorbs more than the other. And I like to give us another example of something that happened to me when I was younger. I injured one of my legs, my left leg. It was never fully rehabbed. It just got injured and just got healed by itself. And so during that time, my right leg compensated and I was able to walk and function. And basically to me, everything was fine. I didn't even have any pain anymore. And a few years ago, I started running and I ended up going to a physical therapist. I was just having slight pain, but I was like, hey, let me go get checked out to see what's going on. And basically he caught that there was that imbalance that I would have never been able to catch myself. And the thing is with an imbalance, because the right leg is taking most of the hit, it was going to eventually get injured. And because that's injured, the left leg will try to take over, but it's weaker, so then it's going to hurt and break. So it was just, this whole imbalance just causes issues. Same thing with your mouth. So putting your teeth straightened and balanced is not just about aesthetics. It's to make sure that we fix the mechanics of the teeth, because we know that when teeth come together like they should, it's just going to be better. They're going to last longer. So think of straightening teeth not just as aesthetic. The aesthetics is just basically the bonus, but function and the balance helps so that you can prevent like gum recession because the bone is not under stress. So then I'm going to go to the next one. I've heard it before, gum disease. So I'm not going to pretend that this is a surprise, but I want to explain it a little differently in a way that you may not have heard before. So gum disease is this bacteria that basically is called gum disease is bacteria, but gum disease is caused by bacteria, and it's caused by bacteria that live in the spaces between your tooth and your gum. So think about it for a second. Let's say you went to the doctor and you were told that you had a bacterial infection somewhere in your body. Would you treat it or would you ignore it? And I'm sure you would treat it. You wouldn't ignore it and say, hey, let's see what happens in 6 months. Or sometimes let's just see what happens. But a lot of people do exactly this. They come over to the general office. We tell you, like, you have gum disease. We need to do the treatment. And most of the time, there's a lot of pushback. And they're like, hey, I'll wait or something like that. But I just want you to know that don't wait, because the thing is, while you're waiting, your body's not waiting. Your body is fighting, and your body is actually fighting an infection. And when your body fights an infection, it breaks down tissue in the process. So the recession that you see is not because the bacteria is causing the damage. It's because your immune system is responding. And if you don't help it by taking care of that bacteria, it's going to lose that fight slowly. And the reason I put gum disease last is because it's something that you know about. But we know that gum disease, obviously, plus hormonal changes, plus bite issues, makes the situation worse because everything compounds. It's just that you have one problem and then it just stacks one on top of the other. So the first part is knowing what's causing it, right? And then now that you know what's causing it, you now want to go find a dentist that you trust and get a full exam, not just a cleaning. I know a lot of times people call the office and, hey, I just want a cleaning, but a cleaning is the very last thing that we do. The first thing that you want to do is to just make sure you have an assessment of your whole mouth. So you want to find someone that's looking at your gum health. You want to make sure that they're checking your bite. You want to make sure that the bone levels of your, that support your teeth are where they should be. You also want to make sure that you're asking questions and that you're understanding what's happening in your mouth. Because it's super important that you understand. You deserve that. You deserve to know. You cannot be a passive participant in your own dental health. And the second thing is, if grinding is the only thing that you do, you definitely get an actual bite guard that's custom made for you, not a generic one. And then the third thing is, if you're having recession in different spots, that's usually a big telltale sign that your bite is off. So you want to make sure you're getting a bite assessment. Ask if your teeth are coming together like they should. Because if nobody has checked that before, then we don't know. And that can keep causing harm over time. And then the fourth thing, if you have been told that you have gum disease and you've been putting treatment on hold or on pause or waiting, stop putting it off. Your body is already fighting. So you want to make sure that you give it a winning chance. And then once gum recession has started, it doesn't grow back on its own without intervention. And depending on the cause, sometimes if you remove the cause, so I've seen it in some cases where it was a bite issue, and with the bite issue, then the gums can grow a little bit all the way sometimes, but not necessarily. But it can happen. Sometimes you need surgery to fix that. But for a lot of people that are dealing with recession, just make the little changes that we talked about. And if you want a starting point, I've put together a free gum health checklist that walks you through things that are worth paying attention to in between your dental visits. And the link is down below if you're interested in that. If this helped you, subscribe. Every week I break down dental topics like this in a way that it is easy to understand. At least I think it is easy to understand. If it's not, please drop your questions in the comments. I read all of them, and I'll do my best to answer as many as I can. Protect your foundation, and I'll see you in the next one.